Looking for a good hair transplant advice, rather best hair transplant advice? Look no further. You have reached the right place. Today we'll discuss case of a 28 years young man who changed his look. He transformed his look with a good hairline, with good locks of hair to comb after he opted for hair transplant at Saraswat Hospital. Actually, he had taken medical treatment for past 5 years at 3-4 different places. He tried minoxidil, he tried PRP, he tried multivitamins, he tried laser therapy, and even few proteins which were given to him, like these are the proteins for hair loss. Let us discuss how his hair transplant was done and how his look changed and how he got his confidence back. Also, you will see how your looks will change, how you will look after your hair transplant through the Saraswat Hospital Peak AI app. So stay tuned. You can see here that the width of the scalp was very much, say around 13 centimeters, and this made the recipient area very large, around 86 centimeters square. By means of trichoscopy, we could find out that at the back of the donor area, the roots were around 2.2 hairs per root per follicular unit, and the density of the hair roots was around 80 per centimeter square. So we could take out around 4,000 grafts after leaving sufficient number of grafts at the back. When we calculated his recipient area being 86 centimeters square and giving a density of 35 grafts per centimeter square, we needed almost the same number, so we could transplant his grafts, taking the grafts from the safe donor area at the back of the scalp only. Please like this video because your likes mean a lot to us. We decided the mid-frontal point of the patient by scientific methods, and then we decided to give him a very special skill in the designing of his hairline and his whole recipient area. What was that? If we implant the hairs, all of them, on the large wide area in the anterior-posterior, in the frontal fashion only, then the hair which will come out will have unnatural appearance. So what we did, we made humps on both the sides. By making the humps, we not only made the frontotemporal angles acute, but we also decreased the number of grafts needed by him, though covering a large area and giving him a good hairline and also a very good parting line to part his hair either from the left side or from the right side as he wishes. So you can see on the screens now that by giving the humps to him, he could comb his left or right hair in the left or right direction and the rest of the hair as he wishes. It is important to note here that we decided to do his procedure in 2 sessions, approximately 1 year apart. Why? Because when we do his frontal and mid-scalp session in the first place, then when we talk to him from the front or from the right or from the left, anyone who talks to him will see his head full of hair. It's only when somebody takes a picture from the top that he would be able to see the baldness in the crown area. So the front and mid scalp will give him frame of his face. We went backwards till the transition zone so that he get good look after this first hair transplant. So therefore we proceeded with the front and mid scalp in this session. If you feel there are certain questions in your mind regarding hair transplant, you can write in the comment section below, or you can call us on the numbers below, or you can WhatsApp us so that we can answer them as per your queries. Now he has come for PRP at 3 months, and you can see blackness has started showing on his scalp, and still lot of hairs can be felt on the recipient area which are about to come. In this picture we are seeing that a lot of hairs have already come, and it is only 5 months, and the patient is very confident, happy, and he's positive about the hairs which will come in due course of time. Now he has come at 6 months for the second session of PRP, and the growth has really made him happy, confident, and good looking. Here at 9 months we can see exceptionally good and robust hair growths, and he is so thankful and happy that he today has come to talk about his next transplant for his crown area. So we'll be discussing his crown area, and most probably within a couple of months we'll be doing his crown area also, and we need to do planning for that. Now we come to the important part of this video, in which we'll tell you that how you can discover how you will look after your hair transplant by this artificial intelligence based algorithm. So in the Saraswat Hospital app, by the Peak AI feature, you can upload your photos, and then the ABHRS doctors, the American Board Certified Hair Transplant doctors at Saraswat Hospital, will give their inputs. Then in 24 to 48 hours, you can get your pictures back of how and what expected results you can think of with your hair transplant. So the take-home message of today's video is always see who is performing hair transplant for you. Always check for the doctor and not for the center alone. Do not go to a center where you cannot consult a doctor. Always look for experienced team who can hold your hand after your surgery, because you are not to be left alone. You are to be taken care of after your surgery. Always see what type of new tools and instruments are being used for you, and always ask for good long-term planning and consultation with your doctor before you proceed for your such important hair transplant procedure. If you want to know more about cost of hair transplant, please click the video on the left, and if you want to see another testimonial of one of our hair transplant patients, click the video on the right.